Welcome, everyone, to the Cardio Seeds podcast. I'm Dr. Svetlana Chamoun, your host. Today, we will explore the present and future of American healthcare, discussing ways to optimize the system and improve the well-being of medical professionals. So, if you are with us, let's dive right in and begin this exciting journey together. In this episode, we will discover why lifestyle medicine is the solution for broken U.S. healthcare system. I did not always plan to start a public podcast. In fact, for years, I was practicing cardiology just like everybody else, taking care of the sick and working for a global cardiac safety research company. That was until a couple of years ago when I had an awakening and realized that the existing U.S. healthcare system was becoming unsustainable and needed an urgent change, and that I had to make my contribution to this change. I started feeling those inadequacies in healthcare system when I became a patient. It was hard to get an appointment, impossible to find a doctor who had time to listen to me, inconceivable to end up without a handful of new prescriptions, and copays increased dramatically. And the lousy but nevertheless expensive health insurance was tying me to my old job like a chain. So something was obviously wrong. As both a doctor and a patient, I started thinking and reading. So, our country spends the largest amount of money in the world on treating chronic diseases like diabetes and high blood pressure. And Americans spend enormous amounts of money on diet, supplements, vitamins, and gym memberships. So, logically speaking, we should be getting healthier, but we're not. In fact, the U.S. has the lowest life expectancy among the developed nations. So what's the problem? The problem is that despite all the spendings, one crucial aspect of healthcare is almost completely left out. It's called prevention. When one doesn't do enough to prevent disease, treating it in advanced stage may be too little, too late. And this is exactly what the disease-oriented U.S. medical system does. It receives patients when they're already sick, sometimes too sick to benefit from treatments, so time is lost. Somehow, for decades, this system ignored the fact that 80% of chronic cardiometabolic diseases were entirely preventable with healthy lifestyle choices. Meanwhile, if the U.S. preventive care was as strong as its therapeutics, it would be entirely possible to improve the overall health of several generations of Americans. After all, regular exercise, healthy diet, and other lifestyle interventions were scientifically proven to be protective against heart disease and diabetes. Of course, to achieve noticeable results on a national level, systematic cardiovascular prevention must reach individuals in communities and must become a widespread medical practice. But before our policymakers can finally put health back into the practice and reimbursement of healthcare, patients like you who want to choose lifestyle interventions will need to find practitioners like me called lifestyle medicine physicians and work together on achieving those goals. But first, what is lifestyle medicine in the first place? This is a simple and powerful therapy that uses fundamental and effective modifications of human behaviors and ways of living to prevent, treat, and even reverse major chronic cardiometabolic disease. The pillars of lifestyle medicine are very simple. They include whole food, plant-based diet, stress reduction, regular exercise program, cessation of tobacco and other harmful substances, good sleep hygiene, and healthy connection with nature and other people. The key word here is a change in human behavior. We must change behaviors to achieve results. And that is what lifestyle medicine doctors like me, especially when combined with health coaching, help you to do. After many years of working as a non-invasive cardiologist and a cardiac safety consultant, I realized that I was a part of the system that made American public sicker, not healthier. I also realized that I possessed a vast knowledge of lifestyle-based cardiometabolic prevention and immense interest in sharing it with my patients and friends. This is when I decided to make a radical change in my career. I got board certified in lifestyle medicine and I got health coaching certification. I left my corporate cardiology 9-to-5 job and pivoted 180 degrees to focus entirely on preventive lifestyle cardiology and health coaching, so I can help people like you make right choices. In my podcast, and I called it Cardio Seeds, I want to talk about holistic cardiology. I want to plant seeds of your knowledge and empower you to start using lifestyle interventions for cardiometabolic prevention and treatment in your everyday life. Sometimes in this podcast, we will discuss scientific and technical topics. And I promise, no matter how complicated the medical topic is, I will break it down for you in simple and easy terms. In each episode, you will learn something that you don't typically discuss with your cardiologist or other doctors, mainly because there is no time for these chats during your appointments. Some of you probably have questions that go unanswered for a long time. Do I really need all these medications? Can I lower my cholesterol or blood sugar with diet and exercise instead of drugs? How do I finally lose weight and keep it off without struggling? Do the supplements that I take really help my heart as they claim? As a patient, you are enthusiastic to understand your body functions and your medical conditions, and you never seem to have enough face-to-face time with your regular doctors to ask all the questions you want. Or maybe you are healthy and want to stay this way, or maybe you gave birth or reached menopause and took a new demanding job and your weight started creeping up. Blood sugar became borderline and you seem to never find motivation to exercise and don't know how to start eating well. No worries, I got you covered. You can send me your questions and comments in the comment section of the podcast, and I will incorporate the answers into my future podcast episodes. Please don't forget to leave your evaluations. If you like the Cardio Seeds podcast, recommend it to your friends and family members who may benefit from it as well. So, let's look closely at why lifestyle medicine is the solution for broken U.S. healthcare system. It's not a secret that the current delivery system and financing structures in the U.S. healthcare system are untenable. The cost is growing, but the population is getting sicker and sicker at alarming pace. The question is why? The answer is because the allocation of resources is completely wrong. The problem is not the food industry on Netflix tempting us with calorie-overloaded delicacies in 6-hour-long shows, even though the food industry blames is a separate topic for discussion some other time. We'll talk about it later. Let's talk about who owns our healthcare, who makes decisions for us, how money should be spent, and who makes all those policies. Well, first, over the past 10 years, private equity firms, for instance, Blackstone or the Carlyle Group, just to name a couple, spent more than $340 billion to buy healthcare-related businesses in this country and around the world. But let's focus on this country. Private equity purchases have included hospitals, multiple physician practices, nursing homes, hospices, even billing management companies for healthcare systems. As a result, many formerly doctor-owned practices do not exist anymore. So a couple of years ago, the American Medical Association, for the first time in its history, reported that more physicians in the United States were employed than own their practices. This is a huge change from the past. So also the hospitals. What's the ownership of the hospitals? In the last decade of the 20th century, most hospitals in the United States were owned by states and cities or by nonprofit entities. They were ties to medical schools or religious affiliations. Recently, however, the hospitals for profit became nearly omnipresent. They took over. Private equity executives have immense wealth, and let's remember, many of them reported to be billionaires. Thus, they have enormous political power, and they can influence government policies in favorable for them ways, not for us, for them. I don't want to single out one person or two persons, but just an example. Steven Schwarzman, the chairman and the CEO of the Blackstone Group, used to be a close advisor to President Donald J. Trump. The impact private equity has on employees and its customers of the companies that it's taken over is not always beneficial. The business of healthcare, you see, the drive for profits is not always beneficial. It can help the administration, but it can be counterproductive for patients and workers. So research shows that when private equity firms acquire nursing homes, for instance, the quality of care of the patients declines markedly. So because the private equity focus on cost cutting and efficiencies in operations, so it can benefit consumers, but only if lower costs are passed on to end users. The problems arise when the push for profits reduces quality. And a very good example of this is the very first months of COVID-19 pandemic, when there was a severe shortage of ventilators, masks, and other equipment to fight the disease. And it was especially evident in those places that were privately owned by hedge funds and, all those private equities. Why it happened? Because to private equity, keeping a surplus of any equipment in reserve costs money, and to them, it's like throwing dollar bills out of the window. You understand? Okay, now we understand who owns American hospitals and medical facilities and who wants to make them super profitable at our expense. Now, let's see, who makes healthcare policies and why they are so hostile to an average American citizen? Well, the federal and state governments make the most important healthcare policies. Technically, the policymakers should represent the interests of their constituents that are interests of yours and mine. Do they, though? Of course not. It is not a secret that every bill that passes through the House and Senate reflects interests of approximately one of the wealthiest Americans who represent a powerful lobby and donate hundreds of millions of dollars to the election campaigns. Even the Democrats, who are supposed to mean well and stand for the interests of the working people, cannot resist the temptation of taking large political campaign contributions and speaking fees. This surreptitious and sometimes overt enticing undermines the original views of the best-meaning politicians and shifts their perspectives toward favoring agendas of their rich donors. How much does an average vote really count? Not much at all. One after another, studies showed that when it comes to influencing any policies, healthcare included, rich and powerful have much more influence than the average American citizen. And those who could benefit from prevention the most, underprivileged, underserved groups of people, are frequently separated by the racial barriers and their voices undermined by voting obstacles. So, the American patients and doctors alike get trapped in a game of big guys with deep money pockets. Huge insurance companies, billionaire investment bankers, private equity firms, drug company CEOs, senators, powerful lobbyists. These guys make billions on people like us through influence in public health policies in favorable for them ways. And that is keeping us busy, sick, and tired. Keep American people healthy, it's not their goal. It is much better for them to work doctors to exhaustion by making them see patients every 15 minutes. To empty patients' pockets by constantly increasing insurance premiums, copays, and drug prices. But without preventive measures, people will be getting sicker and sicker and sicker. So flow of patients will keep increasing, which will be perfect for them as money will keep flowing into their pockets. Meanwhile, expensive medications and procedures will keep us just alive instead of making us healthier as could lifestyle interventions. Private equity and hedge funds now are buying private physician groups at alarming pace and run the financial show, squeezing the doctors into seeing 35, sometimes a horrible number, 40 patients per day, and paying them almost exclusively for productivity. Why do doctors accept that, you ask me? Well, they should not, if I had to say that. They should not, but frankly, they may not have any choice at all. When a private physicians group sells to a private equity firm, physicians lose any right to make decisions how to write their practice. They become regular employees. They make only medical decisions, not any financial or administrative decisions. On top of that, doctors do not have any representation in Congress or House, and big dudes with deep pockets do have that representation. As a result, insurance companies will continue to merge, creating monopolies, will continue increasing your and my copays, and keep paying doctors pennies for their services while pushing them to see 35 patients every day. And private equities will continue buying medical practices and hospital systems. Now, I want you to imagine your typical visit to a cardiologist or an internist. A doctor talks to you as they walk in and out of the room, somehow managing to listen to your heart and order a few expensive tests in between, and maybe giving you 2-3 new prescriptions. 10, 12, 15 minutes. Done. Did you want to talk about your insomnia? Well, not today. What about all the costly pills and procedures they prescribe to you? Part of the deal, right? How about a detailed, systematic lifestyle prescription with a follow-up call? Let me guess, never happened? Health coaching to get you motivated? Forget about it. Sounds familiar and feels frustrating? I bet it does. Seriously though, I'm not here to make fun of fellow cardiologists or fellow physicians. Gosh, on the contrary, I used to be part of the same system and I have highest utmost respect for them. They are extremely dedicated, caring, brilliant, knowledgeable, hardworking, and very much patient advocates. And after all, I'm married to one of them. The hard fact is that traditional cardiologists and internists are severely limited in both time and therapeutic choices by policies imposed on them. And those policies, some of them are called guidelines. And if you step over the guidelines, frankly, you can be sued. It may not be such a huge problem if patients got healthier, as we said, but they're not. On top of that, inequitable distribution of resources continues, and an increasing number of American families simply does not have access to adequate healthcare or insurances at all. So, what is the solution for all this mess that we just mentioned? Well, the solution may be in the practice of lifestyle medicine. Surprisingly, even though holistic medicine has been successfully practiced around the world for centuries and is the foundation of traditional Eastern therapies, for instance, in China and Japan, for the Western world, the lifestyle medicine is a relatively new concept in the practice. Nevertheless, when fully embraced, it will become the foundation of a transformed, sustainable system of healthcare. It is a value-based, not a fee-for-service specialty. Value-based medicine is the practice of medicine that delivers value by improving longevity and or increasing the quality of life experienced by patients, not simply reducing the symptoms. The current medical system is a fee-for-service, so-called evidence-based. Yes, there are multiple clinical trials sponsored by rich pharma and device companies that show benefits of expensive medications and benefits of inserting fancy devices inside human bodies, yes. That medicine or that device becomes a so-called standard of care. It gets added to the treatment guidelines, official guidelines. But you, as a patient, please tell me, can taking 6 or 8 medications at the same time, some of them with potentially serious side effects, or can having, several heart surgeries or procedures, can it improve somebody's quality of life? I guess I know the answer. No, it cannot. So let's go back to the lifestyle medicine. There is a large body of evidence-based data coming from multiple clinical trials that show strong support for the effectiveness of lifestyle interventions in treating, reversing, and preventing non-communicable chronic disease. Whole food plant-based diet consists of mostly food from plants, such as whole grains, vegetables, fruits, beans, and legumes, with little or no animal products. Well, nobody said that overnight patients should become vegans or even vegetarians. Low-fat dairy products, frequent servings of oily fish, so omega-3 fish like salmon, and occasional low-fat poultry like lean chicken breasts are more than welcome. Agree with me that eating healthy and brisk walks in the park 150 minutes per week for cardiometabolic health is much cheaper and much easier than polypharmacy and endless visits to cardiologists. Therefore, I'm adamant that lifestyle medicine interventions should become primary, if not the only treatment and prevention options for a large number of patients. And they will solve the problem of failing American health and fiscally illogical healthcare system. When these interventions, inexpensive and holistic by design, are finally incorporated into the guidelines and become a part of cardiology or internal medicine prescriptions, just like aspirin or metoprolol, they will transform, redefine, and sustain human health and healthcare in the United States and all around the Western world. Let me educate you about the organization that is a galvanizing force for change. Founded in 2004, the American College of Lifestyle Medicine, or ACLM, is the medical professional society for physicians and other professionals dedicated to clinical practice of lifestyle medicine as a foundation of transformed and sustainable healthcare system. The American College of Lifestyle Medicine addresses the need for quality, evidence-based education and certification, and it advocates for its members in their practices and their collective mission to nationally and globally promote lifestyle medicine as the first and optimal treatment option. I repeat, the first and optimal treatment option. I am a proud member of the American College of Lifestyle Medicine. We are united in our desire to eradicate the root causes of chronic disease, not just treat symptoms and consequences. A typical lifestyle medicine practitioner spends 60 minutes with a patient, not 15, not 20. Then there is coaching involved to change behaviors so the lifestyle changes stick for good and make a long-lasting difference on patients' health. It's all worth it. None of it is widespread practice, unfortunately. In 2021, there were only about 3,000 board-certified lifestyle medicine physicians in the United States, out of which were just a few cardiologists. At the same time, there were more than 33,000 board-certified cardiologists in the United States. There are still many, many challenges for doctors who want to practice lifestyle medicine, and the major problem is the lack of reimbursement by insurances. Yes, health insurance companies would rather spend money on covering the sick than preventing the sickness, despite the evidence-based existing out there through multiple clinical trials. You will say, how will lifestyle medicine become a future of the American medicine if all the policies are made by the policymaker backed by billionaires? At this moment, it may be true, but I am an optimist, and we should believe in the power of American democracy, and I hope it still works. Collectively, we need to make sure that it works for our people. Otherwise, the American healthcare system will hit the rock bottom and then will resurrect itself from the ashes, hopefully not too late. As a public, we should not be discouraged by the political ping pong and power battles. We should stand together, patients and doctors alike, for our common good called health and longevity. Our common good calls for reducing use of medications and procedures, for decreasing hospitalizations and visits to the emergency room by introducing widespread public prevention strategies starting early in life. These strategies include holistic lifestyle practices and clean ways of living to achieve and maintain best health. It's diet, exercise, sleep, stress reduction, tobacco cessation, connection with nature, and love. But it's never late to start. One can start at any age and achieve one's best health and reverse already existing chronic diseases. The more health professionals are willing to practice lifestyle medicine, the more patients are willing to accept these interventions, the more health insurance organizations will turn toward preventive care reimbursement. At this moment, patients may need to reserve paying a good practitioner out of pocket, and it's unfortunate for all its good, but look at it this way. Working with a lifestyle medicine physician and a health coach is a great investment in your health for years to come. It may be the best one you've ever made. So please visit the American College of Lifestyle Medicine website to learn more about this specialty and its mission. www.lifestylemedicine.org www.lifestylemedicine.org. Please reach out to your policymakers, including your local politicians, congressmen, and senators. Tell them that you want and you need an urgent change in healthcare policies with lifestyle interventions reimbursed by insurances and included in treatment and prevention guidelines to treat and prevent cardiometabolic diseases. Together, we will make this change. And it's all for today. This was your host, Dr. Svetlana Chamoun, a board-certified cardiologist and a cardiometabolic coach from Ballackinwood, Pennsylvania. See you on the next episode of the Cardio Seeds podcast, where we will talk about the 6 pillars of lifestyle medicine. Thank you for listening. Goodbye.